A point comes after this surgery when the doctors themselves no longer expect Ignatius to live. But then there's a change, and slowly Ignatius begins to recover. Now, when he's well enough to look at the state of his leg beneath the knee on the right leg, what he sees is that a rather visible and ugly clump of bone has formed beneath the knee. The two parts of the tibia, the larger bone beneath the knee, have come together imperfectly, and then the body adds extra bone to try to strengthen this. Now, if you look at paintings of refined male dress in the Spain of Ignatius' time, you see that male noble dress could call for a kind of tight stocking-like garment up to shortly above the knee. And so this is a social disfigurement, and Ignatius refuses to go through life like this and insists with the doctors that this will be now a third surgery on the leg. The French surgeons, the surgery he's just gone through, that the doctors perform a further surgery to cut away the protruding piece of bone. They themselves hesitate because they tell him the leg is healed. This is not going to be quick. The pain is going to be greater than anything you've been through. Again, Ignatius has his way. The doctors perform the surgery. Ignatius tells us that in the autobiography that he goes through a martyrdom for many days after the surgery. The right leg is now a little shorter than the left. In fact, Ignatius will limp a little bit for the rest of his life. The doctors apply weights and instruments to try to stretch the leg as best they can. And eventually a time comes when Ignatius is well in every way except that he can't use the leg. This is the beginning of 5 months of convalescence like this. And this is where God begins to be active.